Dear viewers, welcome to yet another episode of Afya Yako. Today we will be discussing on endometriosis. This is a problem that affects almost 10% of women worldwide. Together with us today we have Dr. Mayembe, who is an expert in this topic. He is a specialist gynecologist and he will be explaining us on this disease, how to manage it and how to help somebody who has this problem. Dr. Mayembe, welcome to the show.
Thank you very much.
Dr. Mayembe, endometriosis is a big problem and we have a lot of talk going on about it in the media, especially with different NGOs trying to sort out this problem. Could you tell us why endometriosis is such a widespread problem? What is it and what causes it?
As you correctly said, endometriosis is now an increasing problem, maybe because of the improved diagnosis that we make. Okay. Previously, we were not having adequate instruments to screen for these problems, and we would treat people with similar presentation thinking it could be another problem. But now, we are making a lot of diagnosis because we have adequate facilities which are capable of diagnosing the problem.
Okay.
Yeah, so it was there even before, but now we are making a lot of diagnosis because of the improved diagnostic equipment.
Okay.
Yeah. So that could be the reason, but the problem was there even in the past.
Okay.
Yeah. So to start with, endometriosis is finding endometriotic glands outside the uterine cavity.
Okay.
So when they are not where they are supposed to be, that is called endometriosis.
Okay.
And most times the organs affected are usually within the pelvis.
Okay.
That is, it could be the ovaries, it could be the omentum, sometimes it can be even in the rectum.
Okay.
So when these endometriotic glands are outside, this is what is called endometriosis.
Okay.
Yeah. And as you said earlier, the percentage, it affects around 3 to 15%. So when you take on average, it's almost 10%
of women
of reproductive age.
Of reproductive age.
It is very uncommon to find it in the menopause and those who have not yet attained puberty. So we call the disease of women of reproductive age.
Women of reproductive age.
So in the Tanzanian context, it's between 15 to 45 years.
To 45 years.
Yeah, because menopause is around 50 in the Tanzanian context. So from 45, someone will be perimenopausal, so sometimes others may attain menopause. When you attain menopause, the problem is very unlikely to occur because you are no more menstruating. Usually it affects women who are menstruating.
Okay.
And puberty is attained around 15 to 16 years. So,
right.
So the range of women who are affected is between 15 to 45 years of age.
So women who are in the childbearing age are mostly affected by this?
Yes.
Okay.
Yeah, so that's about it. And the main problem women would present with would be the chronic pelvic pain.
Chronic pelvic pain. So this is the main symptom.
Yeah, they'll be having chronic pelvic pain, but commonly these women will be having difficulty or they'll be having serious problems when they're in their menstruation days.
Okay.
When they're menstruating. So when they're menstruating, that's when they will experience very painful menstruation.
Okay.
So most people at this time, they would go and take over-the-counter drugs to take care of the pain, but actually they may be having the problem.
Okay, so basically whenever, also if we see in a clinical setting, a lot of women come to the pharmacies or go to general doctors and complain for pain during menstruation. But many of them don't know that there is an underlying condition causing this. Yeah. So obviously they could be having endometriosis since it causes a lot of pain. What's the percentage of women who experience pelvic pain who actually do have endometriosis?
We don't have Tanzanian statistics, but if you check worldwide, those who present with chronic pelvic pain, the statistics shows more than 80%.
More than 80%
could be having endometriosis.
Okay.
Yeah, the problem is with the diagnosis. Most time we miss the diagnosis because we lack the required facilities to screen for this, because for someone to make a diagnosis of endometriosis, one must have laparoscopy.
Laparoscopy?
Yeah, that you have to visualize the endometriotic glands.
Okay.
Yeah, because if you have to visualize in the pelvis, the best thing would be laparoscopy.
Okay.
Now, very few facilities have got laparoscopy.
Okay.
Yeah.
So when you do laparoscopy, you would be looking for the endometriotic lesions.
Yeah, endometriotic glands.
Glands. Okay. And when you I mean you also say that there can be endometriosis tissue in other parts of the body, for example the rectum.
Yeah.
So how would you be able to diagnose for that?
These are the rare sites.
Okay.
Yeah, but commonly it will be within, because the theories behind endometriosis is retrograde menstruation. That means instead of menstruation coming through the vagina, they would go back, they have a backflow into the fallopian tube, then it will be deposited.
Okay.
So when it is deposited maybe in the ovaries,
right,
or in the omentum, or in the pouch of Douglas,
yes,
so that's when this occurs. But it can also go as far as to rare sites.
okay,
It can even occur in the lungs. So if it
Okay.
occurs in the lungs, then one will be, if it occurs in the nose, one will be having endometriotic glands in the nose.
and that means whenever this person has these endometriotic glands in other parts of the body, that means they would also be bleeding from those parts of the body during menstruation.
Yeah, right.
Okay.
They'll be bleeding. If it is in the nose, they'll be having nosebleed, which
Okay.
may be confused with other disorders.
With other disorders.
One may think maybe one is hypertensive or just having any other problems with the clotting defects, but actually one could be having, and it is usually cyclic.
Okay.
Yeah. So whenever someone is in a menses, that's when she would bleed.
Okay.
So we call them cyclic chronic pelvic pain.
Okay. Cyclic chronic pelvic
Yeah.
pain.
But also, when you look in the infertile couple,
Yes.
40 to 50% who fail to conceive have got endometriosis, because
Oh.
one of the complications of endometriosis is infertility.
So basically, almost half of people, of women who can't conceive, is due to endometriosis.
Yeah, from the studies, that's what has been
Okay.
documented.
So, how does endometriosis cause a person not to be able to conceive?
As I said earlier, with retrograde menstruation,
Right.
that means there is a backflow of the menses.
Okay.
And these glands are deposited somewhere else.
Right.
So one, they can be deposited in the ovaries. So once they're deposited in the ovaries, ovulation will be very difficult.
Okay.
And once that happens, even the production of prostaglandins, which
Yes.
make always the uterine very, very responsive to even minor things they would contract, this also
Yes.
makes conception very difficult.
Okay.
Yeah.
So, and this is why actually this problem has come up a lot in the media, because it ends up leading to infertility.
Yeah.
For our viewers, we would like to know that if somebody has endometriosis,
Yeah.
is there a chance later on after treatment to be able to conceive? What are the chances for that?
Yeah, conceiving is there, but this is also at risk.
Okay.
It may not be as easy as someone without a problem.
Okay.
Chances of conception are there.
Is there?
But
Okay.
the only thing that makes it difficult, because modality of treatment also makes, some people use combined oral contraceptive pills,
Right.
which are, these are family planning methods.
Yes.
So you'd be treating a problem but making someone unable to conceive.
Could conceive.
That's one. Number two, sometimes we give drugs which stop menstruation at all.
Okay.
That means you have to lower the hormones very low. Once you make these very low levels of hormone, that means someone not be ovulating,
Yes.
which
Correct.
further makes conception
difficult.
very difficult.
What? Okay. So apart from contraceptive pills and hormone therapy, what other methods of treatment are there for this condition?
For this condition, as I said, you have to visualize the
Yes.
glands.
Correct.
The other thing is you do what we call is ablation.
Abrasion.
Yeah.
Okay.
So when you visualize, you make a diagnosis of endometriosis using laparoscope in the same setting. You can take biopsy and you can also burn. This is what is called the ablation. Burn the glands.
Okay.
Yeah.
So you burn the endometriotic glands that are in places they are not supposed to.
Yeah.
Okay. And after this, it's possible to conceive after that?
Yeah.
There is a chance.
Yeah, with the follow-up, proper follow-up, these women can conceive also.
Can conceive.
Yeah.
Is it true that there's a very widespread notion going on right now that if you take contraceptives, it's a prevention from endometriosis? Is this true? Is it a prevention, and does it help to what extent?
If if the contraception makes you not go into menstruation,
Yes.
it can partly protect you. Because as I said earlier, one of the theories behind endometriosis is retrograde menstruation.
Okay.
So if this person takes contraceptives which make her not menstruate, you can partly prevent. But as I said earlier, the disease, there are no direct cause to this. So if you don't know the cause, it's very difficult to prevent.
Correct.
Yeah. So
So-
these are just, you just prevent theoretically, but
So basically the contraceptives would help reduce the pain.
it will reduce the pain, and if make you not menstruate, then the pain will not be there, because the pain is maximum when someone is menstruating.
But it would not get rid of the endometriotic
The
glands.
will,
Yeah.
the glands will be there. The only
Okay.
definite treatment is visualize and ablate the gland. That
So
is-
basically it's not a prevention as much as just a convenience, you can
yeah.
say.
Yeah.
Okay. A lot of women tend to look at herbal products as well these days for a variety of problems, including infertility, endometriosis. What's your view on this?
The problem with herbal medicine,
Right.
we don't know the contents of the drugs.
Okay.
Had we known the contents of the drug and how much, we could also, because some of the medication that is, these are modern medicine are from the herbal products.
Okay.
They are just purified and they are just quantified. So that, you know, actually, when I'm taking Panadol, I'll be taking maybe 500 milligrams of certain drug. But with herbal medicine, you may be taking a lot of things which may be having other side effects.
Okay.
Yeah.
So basically it's best for obviously for the patients to stick with something they are sure of, because
Yeah.
it can have some long-term side effects.
Yeah.
Have you had patients who ended up having more complications due to endometriosis, which means it was an initial problem and then it led to other problems?
Actually, not really.
Okay.
But the biggest complication would be failure to conceive
Failure to conceive.
and these serious pains during menstruation.
Okay.
So these are the commonest problems. Sometimes the uterus would be too big because the endometriotic glands have spread so much. So at the end of the day, you may end up taking out the uterus and the ovaries to alleviate the symptoms.
So that could also happen.
Yeah. And in developing world, this is among reasons for most of the hysterectomies, together with the removal of the ovaries.
Okay.
Because you remove the site where the pain is, and you also remove the ovaries. Because when you have taken out the uterus, sometimes they will remove the ovaries. But removing the ovaries in younger age would make this woman menopausal.
Yes, correct.
And you know, being menopausal is associated with a lot of complications. So
Yes.
if someone has to suffer for a long period of time being menopausal, even the quality of life is affected.
Is affected.
Yeah.
Okay, so this is why people go for other therapies until.
Done. Yeah.
Okay. Dr. Maembe, it is very important for us to note as well that that many women obviously would want to conceive. Now, there's a lot of doubt and a lot of questions being asked that if somebody has endometriosis, is it possible to get the woman's egg and then make her conceive by a IVF, in vitro fertilization, or by getting a surrogate mother?
Surrogate, no problem. Because
Okay.
with these women, the ovary still contain the eggs.
Yes.
So if you can harvest the eggs, then you can do surrogate
So you can harvest the eggs from the people who have endometriosis,
without any problem.
and so you can do surrogacy
Yeah,
and IVF as well.
IVF as well.
Okay.
Yeah.
So it's not like they cannot conceive completely, it's just they cannot conceive in their own body because
Yeah.
of this
Yeah.
disease. It's okay. It's good that you had mentioned about the different ways that somebody will end up having pain and the complications and infertility. Many people confuse ovarian cysts with endometriosis. A lot of people think it's the same thing. Could you elaborate us on the difference? What is ovarian cyst and how different is it from endometriosis?
A cyst is a fluid-filled sac.
Okay.
So saying ovarian cyst, that means in the ovary,
Right.
there is a fluid-filled sac. But endometriosis is the implantation or finding of endometriotic glands apart from the uterine cavity elsewhere.
Elsewhere.
So these are two different things.
Okay.
Ovarian cyst is just the ovary that is affected.
Okay.
You have a cyst in the ovary.
Right.
Yeah.
And in endometriosis, it's the glands that are in other
and
places.
sometimes someone may be having ovarian cyst with no any symptom.
Okay.
You only make a diagnosis when someone has come for maybe for routine ultrasound. Then when you do a scan, you find a cyst. But when you ask a woman for any symptoms, she may be having no symptom. But with endometriosis, of course, sometimes it can be asymptomatic depending where it is, but most time it's associated with chronic pelvic pain, difficult coitus, that is sexual intercourse, someone will be feeling pain, and infertility.
Okay. Now, I think let's discuss a little bit about ovarian cysts as well, since we came up to the topic. Is it always asymptomatic, or are there some symptoms as well? Can somebody have similar symptoms in ovarian cyst as to endometriosis? Is there pain in menstruation for those who have ovarian cysts?
With the ovarian cyst, it depends which type of ovarian cyst
Okay.
one has, because someone can be having polycystic.
Okay.
Polycystic, that means someone has got a lot of cysts in the ovaries.
Okay.
Or someone can just be having a simple ovarian cyst, which is smooth, it has no any complication. Or sometimes can be having follicular ovarian cyst.
Okay.
So there are various types of cysts.
Okay.
With polycystic ovarian disease, so
Yes.
someone has got a lot of cysts.
Right.
One will be having problems with periods. She may not be having pain, but she'll be having very irregular pain. That sometimes she may not be menstruating for a very long period of time. One may
Okay.
tell you, I ovulated maybe in January, maybe my second year, not ovulation, menstruation.
Yes.
My menstruation was in January.
Correct.
Then the other menstruation maybe was in May.
In May, yes.
And when you check, she's not pregnant.
Aha.
But it's just that she's missing periods.
So the missing of menstruation
Yeah.
and irregular cycles
Yeah.
is could be one of
be.
the signs of ovarian polycystics.
Yeah,
Okay.
which it falls under types of
Types of.
ovarian cysts.
Okay.
That is the main problem. Sometimes they'll be having infertility, and sometimes they'll be having excess hair growth.
Excess hair
That
growth.
is called hirsutism.
Okay.
And they'll be also be having excess of androgens.
Of androgen.
Yeah, so women would have male hair distribution in the pubic area.
Okay.
Yeah. So when women have these symptoms, maybe they should go to the hospital, because with ovarian cyst, polycystic ovarian cyst,
Right.
you have to take history, that is, find the signs and symptoms, then you also have to do lab tests.
Lab tests. What lab tests do you do?
We usually check the hormone profile.
Hormone profile.
That's one.
Okay.
So when we check the hormone profile, usually there is a problem with the hormones.
Right.
And these are what we call gonadotropins.
Okay.
So when we check, you usually find there is elevated levels of luteinizing, because
gonadotropins.
these women will not be ovulating.
Correct.
So the brain will be told there is no ovulation, so produce more hormones which will make this woman ovulate.
Okay.
So at the end of the day, you end up producing a lot of luteinizing
hormone.
which is responsible for ovulation, so that this woman will. So when you check, you'd find their elevated levels.
So they have elevated level of
level
luteinizing hormone.
Luteinizing
Okay.
hormone with normal or reduced follicle stimulating hormone, because the
Okay.
follicles, they are there, but
Are
are not
there.
being released for
Being
fertilization.
released.
So
Okay.
this body will be producing a lot of luteinizing hormone.
Okay.
Of course, sometimes they have got insulin resistance, so they may be having some hyperglycemia.
Hyperglycemia.
So we also check the random blood sugar.
Okay.
But also we do the ultrasound.
Ultrasound.
With the ovarian cysts,
Yes.
you just do ultrasound and you check in the ovaries,
Okay.
in which there must be more than 12 cysts, which are more than 10 millimeters in size.
Okay. More
If-
than 10 millimeters in size.
Size,
Okay.
Yeah, but they should be More than 12.
More than 12 cysts.
And more than 10 millimeters in size.
Okay.
So for you to make the diagnosis.
To diagnosis.
Yeah. But with the endometriosis, you have to do laparoscopy. Ultrasound may just give you a clue.
A clue, okay.
But ultrasound doesn't give you a good image. That's why you have to see. You have to visualize.
You have to
with
visualize
the laparoscope.
with the laparoscope.
Yeah.
In ovarian cyst, you say there was also simple ovarian cyst.
Mm.
Can that simple ovarian cyst cause somebody not to conceive?
Not really.
Not really.
Yeah. Because these are usually, as the name itself, simple. I may do a scan today, find you with an ovarian. I say, okay, let's follow it up, maybe after a month. And you come, I may do an ultrasound. The cyst is not there.
Is not there, okay. Yeah. Now, when somebody has this polycystic ovarian cyst, then what is the treatment for it?
Treatment is divided into two.
Okay.
One would say, does this woman want to conceive?
Correct.
The other issue would be, what are the presenting symptoms?
Okay.
Yeah. If this woman wants to conceive, we have to balance these hormones first. And we have to make the ovary sensitive. We can go with medical treatment or surgical treatment.
Okay.
With medical treatment, we give drugs which make the ovary sensitive to insulin so that this woman can start to. So we usually give these all hypoglycemic drugs. We would give metformin, we would give pioglitazone. All these will lower the sugar levels and will make the ovary sensitive, because sometimes these excess androgens are being produced from the ovary.
From the ovary.
So when you make it sensitive, this production is reduced and you can also reverse the ratio. But also give ovulation-inducing drugs.
Okay.
When you give metformin or pioglitazone, then you give ovulation-inducing drugs. You can give letrozole, you can give Ovamid or clomiphene.
Okay.
Yeah. But you need to be very careful when you are giving ovulation-inducing drugs, because sometimes they can cause ovarian hyperstimulation syndrome. Okay. Although it's treatable, but if someone doesn't seek medical attention early, it may lead to complications.
It may lead to complications.
Yes.
And what is the surgical treatment?
Surgical treatment, one can open. You do what is called laparotomy, or you can do laparoscope.
Okay.
What you do is you go and drill the ovaries. You make holes so that eggs would come out during ovulation. Okay. That is by laparoscope. But when you go in doing the open surgery, that is laparotomy, you do what is called wedge resection of the ovaries, and one will start ovulating again.
Okay. Yeah. So there is a very high chance for women who have ovarian cysts to be able to conceive. I mean, as compared to those who are suffering from endometriosis.
Yes.
Okay.
Infertility with the ovarian cyst is less severe compared to endometriosis.
To endometriosis.
Yeah. Usually, these patients can be managed, and at the end of the day, they can end up having a family.
Okay, yeah. That's very nice. Those who have ovarian cysts, we had said that those who have endometriosis are normally of childbearing age. What about those who have ovarian cysts? Is it for the women in the same age group, or does it even affect women who are postmenopausal?
It's very rare to find it in women who are postmenopausal.
Okay.
But the context of ovarian cysts, sometimes, if it occurs in the postmenopausal, you have to be very careful, because it could be ovarian cancer. Because cyst, as I said, is a fluid-filled sac.
Correct.
Sometimes it can be cancerous, although cancer differ in grades. Yeah. So if it occurs in those who are in the extremes of age, that is menopausal and young age, think of malignancy. You find a mass in the ovary, think of cancer.
Think of cancer, okay.
Before you can think of it.
Okay. So I think, Dr. Maembe, you have given us a very good and educative session today. We have gotten to see endometriosis as well as ovarian cysts, the differences, how they are both treated. I would like to give you a few minutes. What would be your suggestion to our viewers who have this problem of endometriosis and ovarian cysts? What would be your advice to them?
My advice to them would be, with advancement in technology,
correct,
most of the disorders can be found.
Okay.
There's no point of continuing self-medicating. Why? Without knowing the actual what is happening in your body. So I would say for all those who are having chronic pelvic pain, they're having problems of infertility, they're having difficulty in sexual intercourse, some would be experiencing very serious pain. They should go to the hospital, they'll get checked, then if they have a problem, then can be treated. Instead of just self-medicating, then at the end of the day, we would come to us and tell you, you came a bit late. If you had come earlier, this could have been managed easily. Yeah. Similar to the ovarian cysts, they are treatable, and I would say these are less difficult to treat compared to endometriosis. They can be treated with minimal complications.
Yeah. Okay, thanks very much, Dr. Maembe. I think we will have a future program on ovarian cancer and breast cancer as well. Our viewers, I would like to tell them that we have learned a lot today. We have seen the difference between endometriosis and ovarian cysts. We have also learned that the concept and the myth and the thoughts that you cannot have a child, or whenever you have an ovarian cyst or endometriosis, you will be infertile is not true. It actually depends on the case and the situation. And probably if many women had gone to a gynecologist and had gotten checked earlier, they would have been able to conceive a child. Also, it is good to notice that Dr. Maembe had mentioned that ovarian cyst is something that can be easily treatable, of course depending on the stage and the condition. So it is best for women to remember the signs and symptoms that he had mentioned, mainly pelvic pain, and for those who have endometriosis, they'll be having an immense amount of pain during menstruation. For those who have ovarian cysts, it will be excess hair growth as well that is going to accompany that. And it is very important for us to make sure that whenever we see any of these signs and symptoms, instead of just going to the pharmacy and popping pills, it's always better to visit an expert gynecologist and go get a way forward, because as we all know, for a woman, bearing a child is a very important thing, and losing that just because of self-medication or not taking half an hour off going to visit a doctor is going to be very detrimental. Thank you very much, and join us next time on another episode. We will have Dr. Maembe again to discuss with us on various issues.